Steve Krupa, your firm Psilos is a healthcare VC venture capital company, and you say you see a lot of opportunity now in the digital health side of the business because of an announcement by Epic Systems, which is a private company. Why don't you take me through it?
Yeah, Epic Systems is the largest provider of electronic health records to hospitals, which was stimulated by the HITECH Act a few years back. And the issue with those systems is that they've been closed. So they haven't been open to the great computing structure, the infrastructure that we're building in this country through the cloud. By saying that they want to now open that up to third-party applications, they are potentially unleashing access to healthcare data that third-party applications can be built to utilize and automate the healthcare system in a more efficient way. So it's a very exciting time for investors if this in fact comes to be true.
So right now, because they can't invest in Epic Systems because it's private,
Yep.
Who's it going to help? Like Cerner or Athena Health? Some of those type, Allscripts perhaps?
Allscripts, Cerner, Athena Health, perhaps McKesson are all going to have a competitive response to that. Athena Health has more of an open architecture today, but small penetration into hospitals. The other firms have more of a closed system, and Epic's move will cause them to reconsider to be more open. And we could see the development of an application environment for provider-based technology that would open up all sorts of new automation opportunities.
And what's the timing of this?
You know, that is the toughest thing in the healthcare space because there isn't a consumer driving demand. The customers are going to be the providers for the most part, at least in this point in time. But as this begins to open up, the value propositions are very significant to hospitals. And the competitive environment in healthcare is significant. So I think the timing is now, and I think it will open up a 20-year cycle of healthcare investing.
And your firm has a stake in this through something called PatientSafe Solutions. So tell me about that and tell me about who else is going to be jumping in.
Sure. PatientSafe Solutions is one of the only companies that foresee and have a product that is a mobile health network for inside of hospitals so that data and communications can be delivered at the bedside, and you can actually build a real mobile network inside of the provider environment. If they get access to being able to integrate with the electronic health records, the value that that type of an application can create to the point of care is very significant.
And then finally, this is all seems like it's being driven by Obamacare.
Yeah.
We've had a great rally in healthcare stocks for the past few years. How much longer can this continue? Because more people are streaming into hospitals, they're getting the money, people are insured, they're going to hospitals. Stocks can keep climbing?
Stocks should keep climbing, and the technology business in healthcare is going to grow significantly, much in the same way it has in other areas. And people should keep their eyes open. These public companies that we talked about will be likely acquirers of the type of investments that I make. And we're going to be seeing things like Uber, which transformed the car services business, begin to transform the healthcare business.
All right, thanks a lot for coming in.
Yep, my pleasure.
Thank you for watching The Street.